I'm going to show you what an open door looks like. What it will also do is it will cause usually a pokey, or all of a sudden your tooth will be super sore. Alright, so when you have a door that's open, sometimes it will cause an irritation. What you can do is push on the wire close to the bracket, use your other finger and close that door up towards the incisal edge, which is the top of the tooth. So push that door up and it's closed, as easy as that. Now I'm going to show you what it looks like in Melissa's mouth. So Melissa came in today and she has a door that keeps irritating her lower lip right here. So if you look right here, you can see that the wire is going through the bracket and you can actually see that. So what it means is that door is actually open. If you just take your finger, you push really hard next to the bracket, take your finger and you're going to close the door up. So push up, sometimes you'll hear a little clicking sound and then you'll notice that it closes. Now does that feel better or what?
Yes.
Now if you ever get a pokey wire, a wire usually will come out of that back bracket due to shifting, or sometimes if you eat something just right. What you can do is you can take a pair of tweezers or fingernail clippers. At home, hopefully you guys have some rubbing alcohol or hydrogen peroxide. I'm just going to use this and clean it up, make sure it's nice and sterile before I put it in her mouth. Sometimes you can also use wire cutters, they will do the same trick. But if you can, if the wire looks thin enough, I would recommend tweezers first and then some fingernail clippers. Go ahead and grab the wire, pinch it nice and hard, kind of shift it back towards the opposite side of the mouth, and then you can slowly just kind of guide that flexible wire into that very last bracket. So you have to pull pretty hard, don't be afraid of bending that wire. So you get it in that little hole in the bracket, kind of push it through, shift it back a little bit, and what you can do is just rinse with some really warm water, and that will make that wire straighten right back out. So same thing in the mouth. You can take some tweezers, just make sure they're nice and clean. When have your patient lay on a couch where there's good lighting or a bed, you can just pinch that wire nice and tight, shift that wire to the opposite side, kind of make that wire line up with that bracket, and then just kind of feed it through. And that will take care of that pokey wire. Also, another solution is there is a clamp on the wire right here in between the two front teeth. I can show you on this, it's a little bit easier. There's a little clamp right there. So if that wire shifts to the right or the left and is a little pokey, you can take your fingernail, grab right on side of that clamp, and shift it to the side. And that will make it so that it takes away that pokey wire. So if it's sticking out on that left side like this, then again, take your fingernail, get right up there on that clamp, shift it over, and it makes that pokey go away. So sometimes, if you can't get the wire to go all the way to the very last bracket, you can grab some fingernail clippers from home. Make sure you clean them, make sure that they're nice and clean before you put them in the mouth. You want to cut as close to the bracket as you can. So take your fingernail clippers, get it right in between the brackets, do a little snip. Take your fingernail tweezers again, and slowly and carefully just kind of pull out this wire. You can shift it towards the back or the front of the mouth, whatever is easier to get it out. Just be careful so you don't poke them. And there's the wire. Go ahead and throw that in the garbage. Now if that is still causing you a problem, you can also use a little bit of wax. We give you some wax, different brands. One is clear and one is thick. You can use this. Take a little bit of the strip, roll it into a ball. Your body heat will get it really soft and squishy. Go ahead and try to suck off all the saliva as much as you can. Have them swallow really good. Take your little ball of wax, stick it on the area that's bugging them. You can push it and kind of roll it around. It does want to stick to whatever's drier, so you can lick your finger or get your finger wet from their mouth and then push on it, and also push on the outside. And that will cushion it until you can call us and get in, and we can help you get a brand new wire put back in. So now we are done with a pokey wire.